Hi everyone. In this video, we are going to discuss about the certain important short notes regarding the integrated management of the neonatal childhood illness. So, one of the short note is regarding the under five clinics. The first 5 years of child's life form the foundation for the subsequent physical and mental growth and development. Under five clinics were founded keeping in mind this objective. That is, under five clinics, keeping this in the objective as that is the first 5 years of child's life, which form the foundation for the subsequent physical and mental growth and development in the child. The care of the children in this age group is helps in the subsequent good physical and mental growth and development. So that is the objective of the under five clinics, and they were first started in the Africa by the David Morley, the pioneer of broad charts. Then the concept then came to India under the WHO with the UNICEF. The well baby clinics have been running for a long time, and the traditional well baby clinic before the under five clinics, there will be well baby clinics, which was entirely restricted to the preventive pediatrics in infants and young children only. The under five clinics, on the other hand, which combines the concept of prevention, treatment, health monitoring, nutritional surveillance, and education. So these are the components, that is prevention, treatment of the illness, health monitoring, nutritional surveillance, and education into a system of holistic healthcare within resource limitation of the country. Involvement of the community member, that is auxiliaries, which makes the service economical and available to a large proportion of children. So in the under five clinics, there will be involvement of the community members, and it includes prevention, treatment, health monitoring, nutritional surveillance, and education. And experience has shown that it is one of the least expensive intervention to set up to provide the care for the under five children. It can go a long way in reducing under five mortality. So it is very helpful for the reducing the under five mortality by the use of the under five clinics. And the what are the aims and objectives? The aims and objectives are set out in a symbol or emblem. This is a symbol or emblem, that is a triangle with an inverted triangle inside that. A is the apex, which indicates the care in the illness, and the B is uh, the preventive care, and C is the growth monitoring, and D is the family planning, and E is the education, which is touching all the areas. Then about the care in the illness, that is A is the care in illness, which is the apex of the symbol, which represents the felt need of the mother. That is, components of this care in illness are the diagnosis and treatment, X-ray and laboratory services, and referral service. These are components of the care in illness. First is the diagnosis and treatment of the acute illness management, chronic illness including physical, mental, congenital, and acquired abnormalities, and disorder of growth and development. These should be diagnosed and treatment under this care and illness. Then about the preventive care, we have to different strategy for the preventive care, that is by immunization, then by the nutritional surveillance, health checkups, or rehydration. So these are the components under the preventive care. First is the immunization. Immunization against big six vaccine against the preventable disease. The vaccines are the disease are diphtheria, pertussis, tetanus, measles, polio, and tuberculosis. Then national immunization schedule is followed at these clinics in collaboration with the Department of Health and Family Welfare. So another component under the preventive care is nutritional surveillance. It is almost all the nutritional disorders like malnutrition, anemia, and rickets are common in this age group, that is under 5 years, under 5 age. Nutritional surveillance would identify the subclinical malnutrition and also facilitate intervention strategies in collaboration with the ICDS scheme. Then the next component for the preventive care is by the health checkups. That is the continuous health checkups, which helps in the prevention of certain diseases. The health checkups cover physical examination and appropriate laboratory tests. They are to be provided every 3 to 6 months. The frequency of the health checkups in this under five clinics is every 3 to 6 months. The child health card, which provides checklist for this examination, and there will be also provision of a child health card to the mother. Then the next preventive care component is oral rehydration. That is that is, on an average, a child living in the socioeconomically poor community in a developing country will develop acute diarrhea 2 to 6 times per year. Every episode which carries the risk of dehydration and nutritional compromise. Under five clinics which provide ORS for the home use, which has reduced diarrhea deaths by significant percentage. So to prevent the diarrhea deaths, we have to supplement the oral dehydration as a preventive measure. So that is all regarding the preventive care: immunization, nutritional surveillance, health checkups, and oral dehydration under the preventive care. Then about the growth monitoring, the growth chart which shows serial weight of the child plotted against age. growth faltering can be easily detected and health worker can find out the cause and advise accordingly. Thus, that is all regarding the growth monitoring. Growth chart is the major important component in the growth monitoring. And about the D is the family planning. It is in the center of the symbol in inverted triangle. If colored red, it becomes family planning symbol of India. It is indeed a central area of concern for welfare of under 5 children. Mother which receives counseling through these clinics regarding family planning. So the family planning counseling is the most important component of the family planning. Then about the health education, which is the important component which surrounds the triangle, a border that touches the all areas. That it includes educating the mother regarding the hygiene, how and what to feed the child, when she should bring the child for the immunization, danger signs, all these should be educated to the mother in the health education part of the under five clinics. So there are five components like care in illness, then about the prevention, growth monitoring, then about the family planning and health education. These are the components of the under five clinics. Thus, all the components of under five clinics in collaboration with the other national health programs for the child health and welfare can go a long way in improving the life of under five children in India, even in resource limited settings. So the overall aim of the under five clinic is to improve the lives of the under five children in India even in resource limited settings. So that is all regarding the under 5 clinics. The next short note is regarding the pulse polio immunization. It is used as a polio eradication strategy. It includes immunization and surveillance. In the immunization, we have routine immunization and supplementary vaccine given as pulse immunization, ring immunization, mop-up immunization. And we have to survey the area by case definition and laboratory investigation of polio cases. And the ring immunization is called, there will be two doses of 4 weeks apart of OPV given to 5 kilometer area children less than 5 years of age in an area reported to have a polio case. And what is mop-up immunization? In high transmission areas, two doses of OPV 4 weeks apart given to children less than 5 years of age 2 months before transmission season. National Immunization Days, we have to give simultaneous pulse vaccination of all children under 5 years with OPV, irrespective of the previous immunization history. It usually happens in the December, January, February, and so that is all regarding the pulse polio immunization. So the next short note is regarding a procedure known as hand washing. Hand washing, it is a simple and a very effective technique to reduce the spread of infection. So to reduce the spread of infection, we have to do hand washing. The father of hand washing is called the Ignaz Semmelweis. It is mandatory to use 7 steps hand washing technique before entering the NICU. That is, before entering the neonatal intensive care unit, we have to go for 7 steps hand washing. It can be used at community level also to prevent the spread of infection among the general public. Like as in the case of COVID, we also practice the hand hygiene, hand washing technique. In the NICU, before entering each part of NICU, hand washing is must. Alcoholic rub can only be used in between the patients. Remove rings, bracelets, threads, etc. from the hands and fingers. Nails should be cut, clean and unpainted. Wet hands with the water and grab either a bar of soap or liquid soap. Wash hands in 7 steps as shown in the figure below. So these are the 7 steps in the hand washing technique. First is step is the rub palms together, and step 2 is rub the back of the both hands. Step 3 is interface the fingers and rub hands together. And the step 4 is interlock fingers and rub the back of the fingers of both hands. This is the picture showing the interlock of the fingers. Then step 5 is rub thumb in rotating manner. That is by holding the thumb, thumb is cleaned in the rotating manner, followed by the area between the index finger and thumb for both hands. Then the sixth step is rub fingertips on the palm for both hands. Then the seventh step is rub both wrists in a rotating manner, rinse and dry thoroughly. These are the 7 steps in the hand washing technique. So first is rub palms together, then rub back of the both hands, then interface the fingers and rub hands together, then interlock fingers and rub the back of fingers of both hands, then thumb in the rotating manner, then rub fingertips on palm for both hands, then rub both wrists in a rotating manner. These are the steps of the hand washing. So that is all regarding this video. Thank you.